Now we have the former president or the immediate past president of the World Medical Association, our very own Dr. Osahon Enabulele. Many thanks for joining us on the program.
Thank you very much. Good morning, people of Edo State.
Yeah, you have the opportunity to take a global view of the health status of citizens across the world, particularly in Africa. In recent time, we have seen, an upsurge of diseases and all of that. I mean, we're talking about cholera outbreak, one, disease or the other. I mean, what does this mean for the world and its citizens against the background of looking at global health of citizens, interfacing that with policies on the part of the World Health Organization, United Nations, national and subnational governments?
Well, thank you very much. First, let me say it's good to be back to ITV studio. What we all know right now is that health insecurity anywhere in the world is insecurity all over the world. And so anywhere you have these kind of challenges, especially in low, middle income countries, developing economies, it's something that really should concern everyone. And it borders the fact that, look, in these jurisdictions, including countries of Africa, there's still a lot to be done to, eliminate some of those basic problems and challenges that have since been eliminated in other countries. And it calls to question the whole issue of commitment to the health of the people, commitment to good governance, commitment to leadership, and ensuring that those, basic issues are rightly addressed. There's no reason why in this day and time we should still be talking about cholera and some other basic conditions that border on issues of sanitation, issues of hand washing, issues of health awareness, So those are basic issues that in other climes have since been conquered. So I think it's a matter of seeing how we can get, the leadership in some of these countries. So again, rally around those basic ideals of governance, leadership, and commitment to the health of the people so that we can talk about much more important issues. I mean, just now as I speak to you, the whole world is racing towards 2030, which is the target for the Sustainable Development Goals. And I can tell you that over 174, close to about 170 countries, right now, have made commendable progress towards addressing some of those issues that were identified in 2015 when the whole SDG was conceptualized. And unfortunately, over 75% of the countries that are unable or will be unable to fulfill this mandate come from sub-Saharan Africa.
Okay. We've seen in recent times an upsurge of epidemics and all of that. I mean, there's MPV virus or something that just cropped up. Why is it that now we just keep having one new virus or the other springing up? Even those that have been in the doldrum for such a long time suddenly have woken up and maybe they have gotten a new energy. What is responsible for this?
Well, you've heard of this saying that, even when you've achieved success, you don't rest on your laurels. Most of the time, when people think that they have arrived, they just lose guards and, of course, relax on some of those fundamentals that should, on a continual basis, protect the environment, protect the citizens. So it calls to mind again the whole question of how do we engage the whole concept of One Health, for instance, the whole concept of regular surveillance, the whole concept of ensuring that there is sustainable provision for protecting the citizens, protecting the environment, and of course ensuring that we're all on top of our game. It calls to the issue of global health surveillance and national health surveillance and national health security. So I think what we need to do is to ensure that we have sustained vigilance, even within the health environment, to ensure that these things are identified even at the very beginning and staved off. So to make sure that they do not, of course, become, monstrosities and, of course, things that now impair, the health and living conditions of the people. So it calls to mind duty to surveillance, constant, sustained surveillance.
All right, how has your leadership of the World Medical Association impacted your involvement in changing the narratives of governance in terms of impacting the health and the lives of the people, using Nigeria as a case study? You're driving a foundation now. What informed that, and what are we looking forward to?
Well, the foundation, the Dr. Osahon Enabulele Foundation, was bettered as a result of the need to reignite hope amongst our citizens. Because again, yes, I've been to all parts, almost all parts of the world in terms of my global, peregrinations, this couple of years, But I thought that there is also need for us to, cascade this down to the local communities, to Nigeria, to, to the state, and of course, other, less, opportune communities. And so the foundation has come to reignite that hope and giving opportunity for people to know that, look, we can't take charge of our own destiny, we can't take charge of our lives, we can't take charge of our well-being, and without necessarily sucking up to governments, who really have the main fundamental responsibility to look after the welfare and, of course, the needs of the people. So this foundation is aimed at reigniting hope, trying to see how we can do that by promoting those values, those virtues that we all cherish, and fundamentally leveraging on key issues of leadership and governance. How do we, as a foundation, working with other, non-state actors and even government, see how we can promote leadership, excellence, promote good governance, and of course, have that to impact on human development initiatives of health, education, and other areas. So how do we propel that agenda in a way that, allows us to attain the very objectives of Chapter 2, for instance, of the 1999 Constitution as amended, okay. Which borders really on the whole issue of egalitarian approach to governance. Okay. How do we get, the citizens empowered? How do we get them to have, that kind of, opportunity to have access to quality healthcare, for instance, quality education, learning opportunities? Okay. How do we drive policy advocacy? Okay. So this foundation actually is leveraged on those fundamental strategic trusts.
Okay, so finally, what is the major platform now to drive these engagements?
Yeah, the platform is there. That's the Dr. Sahoe Nabulele Foundation. Now, it's going to be launched on the 29th of January at the Akindeko Auditorium with a colloquium, which, of course, is going to, first of all, engage and interrogate the critical issue of leadership in the Nigerian state. How do we engage this issue again in a way that offers hope, in a way that offers some level of progressive agenda, for the citizens? So we're going to have that conversation on the 29th, 10 a.m. at Akindeko Auditorium here in Benin City, in Edo State. Some have asked, why Benin City? Why Edo State? Well, everything cannot be in Abuja. Everything cannot be in London. Everything cannot be in Lagos. I think citizens anywhere in the world have the capacity to engage issues that concern their existence, and of course, especially now that we have very challenging times in Nigeria. So okay. Speakers are coming from far and wide to do justice to these issues of leadership recruitment process, issues of health. How do we attain in more practical ways the health rights of Nigerians? How do we in more practical ways attain universal health coverage, recognizing that even less than that countries in the world like Rwanda okay. have attained these very objectives.
All right. Well, Dr. Sahoe Nabulele, thank you so much. If we have more time,
thank you.
We certainly would have loved to talk to you more, because you're always a delight, on a program like this. But we wish you the very best and congratulate you. Of course, 29th of January is a day that will be with you to, appreciate what you're doing with the foundation and the colloquium. Thank you so much.
Thank you very much.